Great. Preparing. Okay. Hey, everyone. Thank you so much for taking the time to have this conversation today. I think a lot of people want to know what's happening in the DMV, how they can support our immigrant neighbors and, continue fighting for immigration justice, even as most of us are stuck at home. So we're recording this conversation on Zoom because we're having some technical issues with Facebook, but we will all be down to answer questions afterwards and to continue the conversation on social media. So I'm going to start off with just a few short introductions. My name is Jessica Dempsey. I am the volunteer coordinator at the Capital Area Immigrants Rights Coalition. CAIR Coalition's focus is on providing free legal services to detained immigrants across Maryland and Virginia, just the greater capital area. We have a detained adult program, a detained children's program, and an immigration impact lab, all of which are right now focused on protecting people in immigration detention, especially during this time of coronavirus when people in detention are basically at the most risk, whose health and safety are the most at risk. So many of our programs have started working remotely in this time. So I'm going to talk a little bit about how CAIR Coalition is continuing to work, and I'm really excited to have some of our partners in this fight here as well. So we have Claire Dempsey, who is CAIR Coalition's caseworker. She focuses on working with CAIR Coalition clients who are out of detention mostly, and on getting people the resources that they need when they are detained. We also have Alex Taliadoros, am I pronouncing your last name correctly, Alex? Thanks. Who is a community organizer for the Kalamazoo Initiative, a labor center at Georgetown University, and an organizer for Sanctuary DMV and the Congregation Action Network. I'm really excited to have you here, Alex. And then finally, we have Laura Catania, who's a volunteer and community outreach coordinator at Ayuda. Laura manages volunteers, administrative interns, and community outreach initiatives and partnerships at Ayuda, which provides legal, social, and language access services to help vulnerable immigrants in our neighborhoods access justice and transform their lives. So lots of really cool organizations in the room, in the virtual room. And we're going to talk a little bit about what each of our organizations is doing and how we are keeping people engaged remotely. So I'm going to start off just talking for like a couple of minutes about what CAIR Coalition is doing right now, how we're continuing to work while all of us are stuck at home. We're engaged in a lot of public litigation and advocacy to help get as many vulnerable detained immigrants out of immigration detention as possible. As I'm sure many of you can imagine, there isn't much possibility for social distancing when you are in a dormitory full of other people. And we're especially focused on trying to get people who are at high risk of contracting coronavirus out of detention as quickly as possible. So that includes elderly people, people with pre-existing conditions like asthma and diabetes, but also people who have been, members of this community for a long time and have families and communities to return to. So that's been a really big focus of our work right now. We've been really emphasizing our bond program, which is trying to get people out as quickly as possible. On the volunteer side of things, CAIR Coalition isn't actively visiting detention centers. At first it was, because we didn't want to potentially bring coronavirus into any of the detention centers. And now it's just a question of, health and safety across the board. But we are continuing to keep our hotline, which provides access to free calls to access legal services for detained immigrants. We're keeping that staffed. And we have volunteers doing translation and over the phone interpreting. So those are some of the things we have going on, but we're also trying to just keep people engaged through forums like this, keep providing opportunities for education and for sharing resources, especially with everything else going on. So I'm going to pass the floor over to Laura, who's going to talk a little bit about what Ayuda has been doing.
Hi, everybody. Yeah, thank you so much. I'm going to talk about how Ayuda is operating these days. So I didn't know this, but I found out yesterday that our legal and social services are considered essential businesses under all the proposed orders. So those orders have not changed our operations. Our clients' legal and social services needs like emergency funding, emergency food and diaper needs, and our still enforced deadlines that we have to meet for immigration cases continue to be very real pressures at Ayuda, even as we're all working from home pretty much. We have an ethical obligation to meet these needs, and even especially in times of crisis. We're still answering our phones. We encourage our current and former clients to call, as well as survivors of domestic violence, human trafficking, sexual assault, or stalking. We are able to give consultations for family law or social services over the phone, and individuals with previously scheduled appointments for the future are still being encouraged to call for more information. We are not scheduling new immigration consultations at this time, so our immigration attorneys are pretty much focused on the cases that they have already. We actually had to close for new immigration consultations before the COVID shutdowns due to capacity. So that is something that is ongoing right now, is that Ayuda cannot take new immigration consultations, but we are still working with all of our current client population in our immigration law. Survivors of domestic violence, sexual assault, and or stalking in DC are still encouraged to call Monday through Friday to schedule those family law consultations and social services appointments, which we offer via telephone. So we have immigration law at Ayuda, but we also have family law, so divorce, custody, and child support for survivors of DV, sexual assault, and stalking. I've been told that USCIS has canceled all in-person appointments from the 18th until April 1st. USCIS continues to update the most immediate information they have on their website. The immigration courts in Baltimore and Arlington will reschedule all non-detained cases. So that's the cases that Ayuda works on. And those cases that are scheduled for hearings through April 10th will be rescheduled. And USCIS will always continue to update on when they will reopen. Another thing that Ayuda does is a bi-monthly and sometimes monthly pro bono legal consultation clinic. It's how we deal with that overflow and that lack of capacity to take on more cases, is that we start people off with a consultation from our staff so they can, and volunteer attorneys, so that they can at least know what they should do next. Unfortunately, those are closed. We have a consultation clinic scheduled in early May. That's tentative. So we'll provide updates to that on our website if it's going to be happening once the date gets closer. The last two things that I wanted to mention is that in our social services program, so non-legal, our case management program, we are still giving our clients their emergency food and diaper resources from our food pantry and our diaper bank. We may be recruiting volunteers to help with deliveries so that our clients don't have to risk traveling on public transportation to pick up their supplies, but it's a whole nother issue there, so we're working that out. And then interpreters from our language access program and all of our nonprofit service providers that use our interpreter bank have access to detailed information about every situation you can imagine and how to handle that right now on our website. So our team has been really committed to staying in contact with our entire client community, as well as our interpreters and the nonprofits we provide interpreters for. We're really trying to keep the work going right now.
Awesome. Thank you so much for sharing all of that, Laura. I think that's a really good signal of how much work is still going on, despite the fact that we're all working from home, and how much there's still left to do. And it's great to hear that there might be some potential for volunteers to help Ayuda out with some of that deliveries potentially in the future. I know that there's been a lot of need kind of across the board for social services like that. We're going to go over to Alex, who's going to talk a bit about what he's been working on in the organizing front. Alex, take it away.
Hey everyone, it's good to speak with you all, and thank you to CAIR for the chance to share what we're working on. What we're seeing on the ground right now, it's quite frankly very scary. The industries that employed a lot of immigrants have been decimated, and as a result, we've had tens of thousands of restaurant workers, housekeepers in hotels, cleaning workers, domestic workers be laid off at once. And many cases, like it's not uncommon for an entire family to have lost their jobs within a matter of days of each other. These are families that were already living paycheck to paycheck and now don't have any way to pay the rent, don't have any way to get groceries and diapers, don't have any way to pay their bills. A lot of folks might have heard that DC, Maryland, and Virginia passed a moratorium on evictions during the crisis, but the reality is that a lot of immigrant families live in informal housing arrangements where they don't have a real lease, right? So those protections don't really apply to them. And it's the first week of April. Folks have rent due and are looking at the possibility that they'll be out on the street very soon. A lot of people across the country are losing their job, but what's unique about immigrants is that they don't have access to unemployment benefits if you're undocumented and don't have a social security number, and they're also not going to get access to the checks that the government's going to send out as part of the federal stimulus package. So really, there's really no income, no support from government for folks who are a really important part of our community. There's a really robust set of mutual aid networks that's being developed. So if you live in a ward or if you live in a county, look for the folks who are doing that work and plug in. And obviously, if you're in a position where you can donate your funds, maybe you get a check from the federal government that you don't need because you're still employed, consider donating that to the folks who are in need. But the reality is that the need is so vast that we're calling on local governments, starting with DC, to generously fund relief packages that get to immigrants, get to folks who are excluded by our social safety net. There was nothing about this in the first relief package that DC passed, but on Tuesday, they'll likely be voting on a second relief package, and we're really hopeful that there'll be something in there that can go to immigrants and that other jurisdictions across the DMV will replicate that so that we're making sure no one's being left behind in this crisis. And then secondly, more longer term, one of the things that's happened over the last 2 or 3 years that's been really great is that CAIR Coalition and other legal providers have fought and won funding for universal rep programs in different jurisdictions across the DMV. And what that means is if you're detained by ICE, by immigration, you don't have the right to a counsel for your immigration case. Therefore, you're kind of left to fend for yourself. It's really expensive. A lot of folks end up not having the rights protected. But a lot of jurisdictions have stepped up and said, if someone's detained from our community, we want them to have the rights defended. So we're going to pay for a lawyer to represent them. That's happened in DC, it's happened in PG County, in Baltimore, in Fairfax, in Arlington, and other places too. And those programs have grown. They've been very high impact. It's led to a lot of families being reunified, a lot of people coming out of detention and being in their community instead. But now local governments are going to have a lot of budget crunches, right? They're going to have shortfalls, tax revenue that's not going to come in, other expenses due to the crisis. And what we think is really important is for those programs to be protected and expanded now. And also for jurisdictions like Montgomery County that haven't taken that step fully yet to step up and provide that universal rep program to their constituents. And, even in normal times, it's not good to be detained. It's not good to be deported, but it's especially bad for that to happen during a global pandemic. And we know ICE is still active. So it's really important that jurisdictions step up. And just in terms of how to plug into those efforts, I would encourage folks to go to sanctuarydmv.org and just sign up for the listserv and get those updates when there's an advocacy action around the council, and also to follow CAIR Coalition because they publicize a lot of the great advocacy that they do through their social media and through their email list.
That's great. Thank you so much, Alex. And I'm really glad that we're getting kind of different spheres of the organizing and advocacy that's happening right now, especially thinking about these actions that have been going on for a little bit longer, like the work happening with universal representation, right? It's really important to know that even though there is a global pandemic, this kind of advocacy isn't stopping. Like, we're continuing to fight for universal representation. We're continuing to provide social services to people who need them, to like help our neighbors. And so it's really good to hear that. We're going to conclude kind of this portion of kind of just sharing updates from each organization with Claire, who is going to talk about kind of what she's noticed about kind of ways to show solidarity with people who are and aren't detained in this area. Claire, I'll give the mic over to you.
Hi guys, my name is Claire Gillooly Dempsey. Like Jessica mentioned, I'm the case manager at CAIR Coalition. So I'm kind of the social service go-to person. I just wanted to highlight a few ways that you can both volunteer, advocate, donate. So I think one thing that was briefly mentioned was how susceptible and vulnerable our ICE detainees are. And there are a number of organizations working kind of with this hashtag Free Them All slogan. So I will send along a couple links in the chat so you can see. One is Raíces, which does a lot of great immigration work in Texas, the Detention Watch Network, and they have several petitions going around and just exercising social media. In terms of what Alex was mentioning earlier, in terms of being connected and volunteering in your local community, mutual aid is a great way to be involved, especially because it doesn't require any sort of financial commitment. So for example, in DC, there's at least one organization in each ward. There are also several in Maryland and Virginia. I'm a part of mine in Mount Pleasant, and they've already been very plugged into kind of assessing the needs in the community, whether it be getting groceries or for someone or helping them navigate some sort of service online, pulling together resources of organizations that are serving the community during this time, particularly because so many businesses are closed. And so just responding to the needs of your most vulnerable neighbors. And the last thing I wanted to highlight was this sort of rapid response. And so I haven't found any in particular, so I welcome anyone to chime in if they know any in the DMV area. But there are several across the country that I found that are trying to not only advocate that immigrants be included in part of the stimulus bill, but also just raising money for immigrants and people who have been left out. So migrant workers, for example, a lot of people who work in restaurant jobs. So I will make sure to include some of these links for organizations working for issues like this. And I just want to close by saying that I've been reading a lot about issues with crowdsourced funding websites. So if you find any way to make your contribution, if you choose to donate as direct as possible to the recipient, obviously that can be very difficult. But a lot of people are organizing fundraisers through Venmo or PayPal. And I would say, you know, do your due diligence in terms of screening it. But if you feel comfortable, I would encourage you to donate rather than sites like GoFundMe, because a lot of people are having trouble receiving those funds just due to the increase in demand from these websites. So it's a personal choice, but I just wanted to throw that out there because I think that's something that could be overlooked.
Yeah, that's a really great point to highlight, Claire, and thank you. And we will definitely share some of these resources and networks that we've seen popping up. As Claire mentioned, like, she's part of her local mutual aid network, but most of us these are things that we've seen happening in our communities and have kind of caught our eye, but I personally can't speak kind of on behalf of any of them. I do want to note that I think it's really cool that this mutual aid network has started coming up kind of as a response to more traditional ideas of like charity or philanthropy. Really, this is about like neighbors helping each other rather than kind of relying on larger institutions. And as Alex mentioned, we can't always rely on the government or other institutions to provide things like stimulus funding for undocumented folks or things like that. So that's one of the reasons why mutual aid can be really important. I'm just going to pause for a second because I'm getting a note that my internet connection is unstable. Can you guys hear me okay? Okay, cool, thank you. Okay, great. So
Can I chime in and say one more thing before we close out? Yeah, I just had two things that I forgot to say when it was my part. And I really appreciate what Claire and Alex, you guys have both talked about. This has been really informative for me as well. One thing is that I just wanted to shout out that our development department at Ayuda put together a client relief fund that is about $500 away from their max goal that they had even given a whole nother month for it to meet. So we're using these funds right now to purchase gift cards that we can give out to our clients so they can use that cash assistance however they need. And it's been tricky to get that going quickly, but it's been an incredible show of support from the community that are thinking about Ayuda's clients who are all low income, many day laborers and construction workers, restaurant workers, all types of positions that they can no longer work for. So that's been really great. And I just want to leave on a note of positivity that there is a lot of help that's been being pushed forward that I can see as far as from my world and the type of clients that we have getting that support. The other thing is that I just want to shout out that the census is here. So everybody take your census and encourage your client population to take the census. It's really important for allocating federal funds properly. And it's nothing to fear. And if you need more information about that, feel free to contact me. But I would ask everyone to spread the word about the census. And that's one way you can help support all of us right now, is to talk about the census, learn about the census, and fill out the census.
Absolutely. And if I can jump in for one last thing as well, I think it's really important to say that a lot of the communities that we serve are very vulnerable to coronavirus and are older, might be sick, might have other conditions. So if you're listening, like, please do your very best to stay at home. Every precaution is an act of solidarity and care for your community. It's not easy for us as providers to be cooped in, or as organizers to be cooped into our homes. So we want to get out there and be back with the people again. And the sooner we all kind of bundle up and stay at home, take those precautions, the sooner that can happen. So please keep that in mind, wash your hands and stay at home.
Thank you, Alex. Also, because our client population doesn't normally have any access to healthcare, if they do get sick or may fear going to a hospital or reaching out if they are in trouble. So that's another reason for practicing social distancing, as well as the other ones that you mentioned, Alex.
That's great. I think that's a really excellent note to end on. You know, sometimes, especially right now, inaction as far as, you know, not leaving your house or trying to stay in as much as possible can be a really important action to help people. So that's a really important thing to keep in mind. I think right now, while there aren't as many in-person ways that a lot of us can stay engaged, education and kind of sharing resources and sharing news as it comes up can be really important too. Just staying engaged in these issues so that when we do return to business as usual, whatever that is, all of us are ready to hit the ground running. I want to make sure everyone knows, you know, the work isn't stopping while all of us are, you know, stuck at home, and there will be even more to do once all of us return kind of to our everyday life. But in the meantime, Laura has shared Ayuda's response fund. Alex has shared ways to get plugged into Sanctuary DMV to get involved in advocacy, and CAIR Coalition has our bond program fund. We're trying to raise money for our bond program so that we can help get out more vulnerable people from detention. So there are plenty of ways to get involved. next week, fingers crossed, we'll be able to do a similar conversation live. But once this is published, we will make it open to questions so that Laura, Claire, and Alex and I can all respond to things and keep the conversation going. Is there anything else you guys wanted to conclude with? We're all good to go.
No, I think that's it. Thank you so much for leading this and inviting us to be part of this.
Yeah, thank you.
Thank you so much, Jessica and Alex and Laura, for coming.
Thank you all so much. I'm going to close out. Thank you all. Stay safe and healthy, and we will talk soon.
Thank you. Bye.
Bye.
Bye, all. Thanks for joining.